Welcome everyone to the Healthy School Food Summit, brought to you by the Coalition for Healthy School Food and PlantPure. I'm your host, Ron Gandiza, and in this session, we are honored to have with us New York Times bestselling author and popular speaker, Dr. Michael Greger. Dr. Greger is a physician, author, and internationally recognized professional speaker on a number of important public health issues. His recent scientific publications in the American Journal of Preventive Medicine, Biosecurity and Bioterrorism, critical reviews in microbiology, family and community health, and the International Journal of Food Safety, Nutrition, and Public Health explore the public health implications of industrialized animal agriculture. Dr. Greger is also licensed as a general practitioner specializing in clinical nutrition and is a founding member and fellow of the American College of Lifestyle Medicine. And his latest book, How Not to Die, became an instant New York Times bestseller. And it's really one of my top favorite. I'd say it's one of my top three next to the Bible and Colin Campbell's China Study. It's one of my favorite books. And his website and nonprofit charity, nutritionfacts.org, is considered by many to be one of the top resources in the world for information on plant-based nutrition. Thank you so much for joining us, Dr. Greger.
So happy to be here.
Now, as you know, in this Healthy School Food Summit, we're exploring the challenges of bringing plant-based nutrition or healthier foods into schools. And I'd like to get your opinion and really your experience in terms of the trend that we're seeing with children. How important is nutrition now for kids?
Look, it's critically important for everyone. You know, according to the Global Burden of Disease Study, the largest study of disease risk factors in human history, funded by the Bill and Melinda Gates Foundation, the number one cause of death in the United States is our diet. The number one cause of disability, the number of healthy years lost, is our diet. Now bumping tobacco smoking to number two, cigarettes not only kill about 500,000 Americans every year, whereas our diet kills hundreds of thousands more. Many of these chronic diseases, like whether it's, type 2 diabetes or, low back pain, all the way down the list, are starting earlier and earlier. And now we're even seeing it among our children. So it's never too late, not only to start eating healthier, it's never too early to start eating healthier either. And what better place to do it than in our schools? And look, the food industry knows this, right? That's why the National Cattlemen's Beef Association, for example, spends millions of dollars getting, educational materials into the hands of teachers, because they know, look, if we can reach them young, we can kind of mold them into be future consumers. And so wouldn't it be nice if we were able to get some fruit and vegetable information into their hands as well as feeding them healthier during lunchtime?
Now, I've heard reports that children actually face even heart disease. We tend to think of these diseases as something when you're middle age or older, but I've seen it as whether it's 10 years old or even as young as 7. Is that true?
Oh, well, these diseases may not manifest clinically until our middle age. The first signs of these diseases, which we can find at autopsy during a series of basically accident victims, what you can do is you can see that by age 10, nearly all children raised on the standard Western diet already have what are called fatty streaks within their arteries. These are the first stages of atherosclerosis, the number one killer of both men and women in this country. These streaks start turning into plaques in our 20s, get worse in our 30s, and then can start killing us off. In our hearts, it can be a heart attack. In our brain, the same disease process can be called a stroke. And so these are our leading killers, and starting early. In fact, the earliest data actually shows that third trimester infants, you can actually see the beginnings of arterial lesions, which are actually correlate to the mother's cholesterol levels. And so it may even start in the womb. And so that's why it's critical to stop this disease process early and not just try to reverse it later in life.
Now, in addition to obesity, because we know child obesity is a growing problem, but are there any type of behavioral problems that you know of that may be associated with a poor diet?
Oh, well, we know there are lifestyle approaches to dealing with, for example, attention deficit hyperactivity disorder, ADHD, that exercise can work as well as the drugs that are being prescribed. Fortunately, they don't last as long, so one has to do these frequent bouts of exercise, which doesn't fit in well in kind of the current school system that we have. But it just shows that there are natural approaches that don't involve dosing our children with amphetamine type drugs. And I mean, but yeah, we have good data showing that healthy eating and proper hydration can improve academic performance both acutely and chronically. And so it's important for our brains as it is for all the other organs in our bodies.
Now, I'm not sure if you know this off the top of your head, but you seem to know a lot of things in terms of the stats, because that's one of the things about nutritionfacts.org I love is seeing these stats. But in terms of when kids, if they don't improve their diet, which we know it seems to be getting worse as if they progress through the years up until they graduate from high school. So what are we seeing as they graduate from high school because of, let's say, this lack of action, right, in improving their diet?
Oh, well, I mean, what we would see if we were able to look inside them is the beginnings of the chronic disease. I mean, this dates back, I mean, we first discovered, I mean, we were kind of shocked in the medical community when the first cases started coming back from the Korean War. That's actually where it started. This landmark article published in the Journal of the American Medical Association showing that Korean War victims, so these were soldiers, average age 21, I believe, and many of them had these advanced stages of atherosclerosis, some of them triple vessel heart disease, serious. So we're talking up to 90% blockages in some of those coronary arteries at 21 years old. That was a real wake-up call to, wait a second, this heart disease, the #1 killer of men and women, in fact, every single year since 1919 in this country, it's not just a disease of old age. It starts early, and so we need to start treating it, preventing it, reversing it early. And so that means we need to clean up our diets. And so, you know, I mean, this is, look, I mean, the good news is, look, even late in life, you can reverse some of these diseases. But the reason you don't want to just wait is that the #1 killer, the #1 way people die from heart disease is what's called sudden cardiac death. I mean, you don't even know you have heart disease. For most people that die from heart disease, it's not like decades of chest pain and treatment and stents. Actually, for a little bit over half, about 51%, it's actually sudden cardiac death, meaning a death within an hour of one's first symptoms. So you don't even know you have heart disease. You've never been diagnosed with heart disease. You feel perfectly fine. And then from that first twinge, from that first pressure in your chest or your arm, you're gone from the earth within 60 minutes. And by then it's just, you know, no matter how much, you know, even if you skip your favorite fast food joint in the ambulance on the way to the hospital, it's just too late at that point. An ounce of prevention is worth way more than a pound of cure, because there is no cure for dead. That's why we need to prevent these diseases early, and the earlier the better. Look, let's get these healthy eating patterns started, you know, in the household, started before they go off to college, started in school. Look, we have health class in school, and if the #1 cause of death and disability in this country is our diet, then shouldn't the bulk of health class be about nutrition, about the healthiest things we can put into our body?
Now, you do a lot of seminars and lectures around the world. So do you have teachers coming up to you? I'm assuming you do. You must have some teachers or school officials coming to you asking for advice or guidance with their schools and helping children, or even parents coming up talking about their children. What do you tell them?
That's actually the reason that I helped start a new organization called Balanced. So at nutritionfacts.org, basically we, scour through the peer-reviewed medical literature on nutrition, and bring kind of the latest and the groundbreaking, practical, interesting findings out to the public, and new videos and articles every day uploaded to nutritionfacts.org. So the science is there, but I think I had this kind of naive view when I started this, that if people just knew the truth, that if we just got the information out there, then, they would just naturally like, well, look, I don't want to die. I don't want to be sick. I want to live to see my grandkids grow up. And so they would naturally just, make the changes necessary. But then one realized, look, people need tools to actually put these into practice. And so I realized that we needed to do more than just put out the information. We really needed to, institutional change, whether it's our schools, whether it's our workplace cafeterias, whether it's, all the very big institutions. We really needed to offer them tools to actually put it into practice. And so, we tried to find the best talent in the world to come together. So a new 501c3 nonprofit called Balanced. You can go to balanced.org, which just got started, is off the ground, and actually started by an educator, Audrey Sanchez, who is hoping to provide these kind of tools to schools that are interested in making the transition, whether it's, dipping their toes in the water with some kind of, meatless Monday or lean and green Thursday or whatever you want to call it, that some schools from LA, some of our biggest school systems are already doing some of these, implementing more kind of plant-based meals into their schedules, to, just radically changing their school lunches, to really best support the nutrition and well-being of their students. And so that's probably what I'm most excited about. Still in the early stages here, but hopefully we'll be able to offer those tools. So Nutrition Facts can give you the information, and then to actually put it into practice, we'll have tools for doctors' offices, for for workplace wellness programs, for school cafeterias, anybody who wants to find ways to incorporate this into their day-to-day living.
We'll make sure we put that on the website as well.
Great.
Out there. And congratulations on the book on how not to die. I'm assuming you're still promoting this and really going out there and talking about the book.
Not so much in person anymore. I spent about a year on the road, did about 200 cities, but now I got to get back to work and start working on the next one. And so, but I mean, look, it's about 18 months out. I mean, it's still in the top 100 Amazon bestsellers even now, which is just amazing. And so, I'm so glad I wrote it, and I've got 4 more books in the pipeline. And so back to research, back to the library, and looking forward to putting out the next one. Oh, have a cookbook coming out in December.
Oh, really?
It's by cookbook. Yeah, so that's exciting. In fact, it just went off to the printer like last week. It's amazing how long, evidently because it's so, fancy and glossy with all the pretty pictures, it takes a lot of time for them to, so, I mean, this is months before it's going to be out, but it's locked down and out, and yeah, that'll be fun. There's another tool people can use to hopefully find some yummy ways to improve the health of their family.
And we're hoping to provide teachers access to these resources, and there's so much actually being developed, and that's one of the challenges, right, is that there's so much information on the internet that you tend to get information overload. And so finding these gems, if you will, that are hidden to share with teachers and get teachers talking to one another with, not just within their schools, but within schools around within the nation, and then, of course, worldwide. That's what we want to foster. And, PlantPure, we're all about sharing, right? That's the key word there. So we appreciate your help with, especially nutritionfacts.org. That's actually my go-to place. The minute someone asks something, I look it up. Go to nutritionfacts.org, do a search, and it's very unusual if I don't find a topic that you discuss. It's unusual for me not to find a topic that you don't discuss. But how long has nutritionfacts.org been around?
It's wow. So we celebrated our 5th year last year. It started in 2011. We're up to about 1,300 videos now. And yeah, if there's ever a topic that you don't find on the site, please let me know, and I'll make sure to do some videos about it. One of the latest things that came up, lectins. This book just came out, something like Plant Paradox or something, claiming that there's these lectins found in foods like beans, and we should avoid beans, which is just such crazy talk to me. But if you type in lectins, nutrition, I have no videos on lectins. But look, if people are interested, I'd be happy to do some videos on lectins. So I've added them to my list. And so if ever you run across anything you want to know more about, some supplements, some food ingredients, some fruit you've never heard of, whatever, let me know, and I'll make sure to do some videos about it.
Well, we really appreciate that. And for the educators listening to this, understand that when you go to nutritionfacts.org and you type in the search for a particular topic, what's nice is these, if you're not familiar with this, the videos they're relatively short, right? They're between 3 to 5 minutes. They're what I call bite-sized, that they're easy to absorb, and you can play these in the classroom. They're not something where you're going to worry, is the content kid-friendly, for instance, or should I say, nothing strange in them. They're, if anything, you've got science behind it. You show a lot of animations or graphics at times, plus you have the citations. You actually reference the articles and the research papers, and people can click on those many times right there in the description. So that's a great resource for teachers. So I highly encourage teachers to check that out. And thank you so much, Dr. Verrier, for your time with this Healthy School Food Summit. As usual, you're such a great supporter of PlantPure, and I really appreciate you just jumping in and helping us with this effort.
Anything I can do to help, keep up the wonderful work. Anything I can ever do to help, just let me know.
Appreciate it. And for the audience, thank you so much for joining us. Just visit the healthyschoolfood.org website. That's the website for the Coalition for Healthy School Food, healthyschoolfood.org, for more information about those efforts. And don't forget, you can visit plantpurenation.com to find out what we're doing in terms of plant-based nutrition and the plant-based movement. Again, plantpurenation.com. Thank you so much.